Meningitis is a serious and potentially life-threatening disease that affects the protective membranes, called meninges, that cover the brain and spinal cord. When these membranes become inflamed, it can cause severe symptoms and may lead to complications if not treated quickly. Meningitis can be caused by viruses, bacteria, fungi, or parasites, but the most common and dangerous type is bacterial meningitis. The infection usually starts when germs enter the bloodstream and travel to the brain or spinal cord. Sometimes it can occur directly when bacteria invade the meninges due to an ear infection, head injury, or sinus infection. The most common bacteria that cause meningitis include Neisseria meningitidis, Streptococcus pneumonia, and Haemophilus influenzae. The symptoms of meningitis can appear suddenly and may vary depending on the cause. The most common signs include high fever, severe headache, stiff neck, nausea, vomiting, sensitivity to light, and confusion. In infants, the symptoms might be different, such as constant crying, poor feeding, sleepiness, or a bulging soft spot on the head. In severe cases, seizures and loss of consciousness can occur. Meningitis spreads through droplets from coughing, sneezing, or close contact with an infected person. This is why it can spread easily in places like schools, dormitories, or crowded areas. Good hygiene and avoiding contact with sick individuals are important preventive steps. Diagnosis of meningitis usually requires a physical examination and a lumbar puncture, also known as a spinal tap, which helps test the cerebrospinal fluid for infection. Blood tests and brain scans may also be done to identify the cause and rule out other conditions. Treatment depends on the cause. Bacterial meningitis is a medical emergency that requires immediate treatment with intravenous antibiotics and sometimes corticosteroids to reduce inflammation. Viral meningitis, on the other hand, is usually less severe and may improve on its own with rest, fluids, and pain relievers. Fungal and parasitic meningitis are rare and treated with antifungal or antiparasitic medications. Prevention is very important. Vaccines are available for several types of bacterial meningitis, including the meningococcal, pneumococcal, and Haemophilus influenzae type B Hib vaccines. Keeping vaccinations up to date, maintaining good hygiene, and avoiding close contact with infected people can significantly reduce the risk. If meningitis is suspected, immediate medical attention is crucial. Early diagnosis and treatment can save lives and prevent serious complications such as brain damage, hearing loss, or learning disabilities. Meningitis is a dangerous disease, but with awareness, vaccination, and quick action, it can be effectively controlled and prevented. Subscribe my YouTube channel.